All right, everyone. We're going to go ahead and get started. It's 10:04. Hello again, and thank you for joining us for this UNC Health Media Briefing. My name is Brittany Phillips, and I'll be facilitating this Q&A session along with my teammate, Carly Gabriel. To answer your questions about COVID-19 vaccines and children, we have three UNC Health and UNC School of Medicine experts with us today. This briefing is being recorded and will be shared shortly after this call is complete.
Thanks, Brittany. And allow me to introduce our experts. Dr. David Wohl, who we have now, is a professor in the Department of Medicine, an infectious diseases specialist, medical director of the UNC COVID-19 monoclonal antibody infusion clinic at Meadowmont, and helps direct UNC Health's COVID-19 vaccination activities. Dr. Peyton Thompson is assistant professor in the Department of Pediatrics and specializes in pediatric infectious diseases. Dr. Herman Naftel is an assistant professor in the Department of Psychiatry and specializes in child and adolescent psychiatry. We'll begin with an opening statement from each of our three experts. Dr. Wohl, let's start with you.
Great. I don't have very much to say, and I would listen to whatever Dr. Thompson says, because she's who I go to when we're talking about people who don't make the height requirement for the roller coaster. So I think you'll get a lot of good information today, but I do think this is an exciting moment for us. I think this is really important, and we'll talk about that today and why this is not really the cherry on top, but really I think a very important development in us getting on top of this pandemic. Over. Thank you.
Dr. Thompson.
Thank you for the vote of confidence, Dr. Wohl. I, for one, will say that I'm very excited. This is a momentous week in the pandemic for younger children and potentially a real turning point for pediatricians, for parents, for children.
And Dr. Naftel. Oh, you're still on mute. Try one more time.
Okay, thank you. Yes, very exciting times with approval to get ages 5 and up vaccinated. This has been it's been a really difficult last 19 or 20 months for the world and for people in the United States. And I think there's a lot of fear that people have about the illness itself, about vaccines. And I think it's important to think about putting political leanings aside and really listen to the scientists and practitioners in the field. So I'm hoping we can help with that.
All. We'll open up for questions in just a moment. You can type your questions in the chat box or ask our experts directly. First, though, we're going to start with Dr. Thompson and a question our doctors have been getting quite frequently. Doctors Wohl and Naftel, please feel free to chime in as well. Dr. Thompson, is there anything a parent should or should not do before, during, or after their child receives the vaccine?
Sure, that's a great question. And I think that we all, as we got vaccinated, we're wondering the same thing. What do we do to prepare for it? What do we, what can we expect after the vaccine? And I think one thing to prepare for is to make sure that your child has about a day or so for potential recovery after the vaccine in case they have fatigue and muscle aches and potentially fever after the vaccine. So you don't want to schedule their vaccination dose the day before a big test or another big event. The question of whether to pre-medicate before the vaccines, I would not recommend pre-medicating with Tylenol or Advil ibuprofen before the vaccine, but make sure you have some on hand because it can definitely help with the some of the side effects, the arm pain, the body aches, et cetera.
And we can open it up for anybody else who wants to ask questions.
Okay, well, we have some prepared questions that we can continue asking until someone else is ready to ask their question.
I'm sorry,
then-
if I can jump in. This
Great,
is
Richard, go ahead.
Yeah, this is Richard Stradling, the News Observer. I just tried typing one and it may not have shown up yet, but I know a big concern for some parents, and maybe it's the biggest concern, has to do with side effects from vaccination. And I'm wondering what you all would tell parents who are reluctant to get their child vaccinated because of potential side effects.
Sure, that's a good question, and obviously a concern of many parents and of many adults who also got vaccinated, right? So what I would say is that for the most part, the side effects are very similar to those that we see in adults and older children, and are very transient in nature. And so while you are likely to have some fatigue, some headaches, some body aches, I had them, they're likely to go away within a day or two after the vaccine. And we really don't see as many, long-term side effects from these vaccines, from Pfizer and Moderna in particular. The one that has been brought up, of course, over and over is myocarditis, or inflammation of the heart muscles. That is a very rare side effect that we're mainly seeing in older teenage boys. So the age range has really been 16 to 29. And we've seen for every 1 million doses of vaccine that have been given, we've seen ranging from 20 to 40 cases. And when you compare that to actually getting myocarditis from COVID infection itself, the infection is much more likely to lead to that effect of myocarditis. So we see about 450 cases per million of myocarditis in this population from COVID itself.
Thank you. If nobody else has a question, I'll jump in with the second one, which was actually inspired by one of the questions in the press announcement, which is that things are going well. My child's been back at school for months and no one's gotten sick. And do I really need to go through the trouble of going to get my child vaccinated?
That's seems very rare to me that some schools have had reported 0 cases. I mean, that's great that some schools are able to, continue precautions, keep kids outside as much as possible, masked up, and prevent transmission. And largely, we don't see as much transmission in school settings. It's more children are getting COVID in their homes or in community settings and then bringing it into school. And we know, I know from friends and family members what a headache it is for children to get exposed to COVID, for whole classrooms to have to be out for a week at a time, for parents to have to stop working for a whole, 5 to 10 days. It can be a real pain. And so I think that is one of the primary motivators, I would think, for parents to get their kids vaccinated, for teachers to want their students to be vaccinated.
Hey, this is Patrick Thomas with Spectrum News, Dr. Thompson. So I kind of had a thought a second ago. We're talking about a sigh of relief for parents and largely children, but what about some of these teachers who I'm sure will feel maybe a little bit of relief knowing the children sitting in their classroom will be inoculated?
Yes, definitely. I have so much respect for teachers, and especially during the pandemic, being virtual. And I know that being in person again has had its challenges. And one of those being, the teachers can get exposed, the children can get exposed, and just how much stress that induces in the classroom. And so I can imagine that for many teachers, it would be a sigh of relief, as you said. One thing that comes up is it would be nice. There was a New York Times article earlier this week. It would be nice if we had some end point for when can we no longer wear masks in the classroom. We're not there yet. But I think, that's another motivator for the vaccines is, eventually we could hopefully get to the point where COVID is just another viral illness, another cold, right? And we won't necessarily have to have kids masked at all times in the classroom. And I think that that's something in the future, but I don't know the timeline of that. I don't know what that looks like, but hopefully someday we can get there.
Hi, this is Judith with CBS 17. I was a little late to hop on the call, so apologies if this has been discussed already, but I was interested in hearing what you had to say about vaccine equity for kids. I know that was a little bit of an issue in the initial rollout for adults. Do you anticipate that being an issue for kids? And what needs to happen to make sure that kids anywhere have equal access to this vaccine?
Thank you. That's a really great point. And I think something that we need to think strongly about. I know it was an issue for many working class families to get time off to get vaccinated. And it wasn't until, their employers really got behind it and allowed for them to have time off to have the flexibility to get vaccines in different locations. And I think we really do need to think about that with children. Nowadays, it's different, and Dr. Wohl can probably speak more to this because he's run a lot of these vaccine clinics, but we now have vaccine available in many pediatricians' offices. And so it's much more accessible, I would say. This week, the vaccine for younger kids is being rolled out. It's a smaller dose. It comes in a different vial. There's a different, needle to give the vaccine. And so that's all in place. But I read somewhere that, there should be 20,000 locations for children to be vaccinated across the states. And so hopefully that'll help. I mean, I think that we still really need to think about equity, and we need to make sure that parents are able to get the time off to take their kids to get vaccinated, that they can have a day to help their kid recover after if they need to. So these are definitely things that need to be brought to the forefront from policy standpoints.
Yeah, I think Dr. Thompson's right. I think this is very different from when we rolled this out for older people and then middle-aged folks, and then even the 12 to 18-year-old, where we had mass vaccination clinics, but didn't have a more decentralized approach, especially pharmacies. And the vaccine access through pharmacies was a game changer. And we saw large numbers of people be able to get it. The other thing is that we've just learned that there's thousands of pediatricians already signed up. I mean, they're taking appointments right now to start giving vaccine. So I'm hoping that those are pediatricians and pharmacies that are located and distributed throughout the state equitably. Hopefully that's the case. Hopefully the CVSs and the Walgreens and such everywhere will be making vaccines available to folks, including in rural areas. So I'm keeping my fingers crossed, but we don't need a drive-through or mass vaccination site for these kids. This is going to happen on a little bit, more of a rolling basis. But I do hope that people will have no trouble getting their kids vaccinated.
And, there's a lot of families out there who maybe have younger kids or have mixed vaccine status in their household. How should those families handle, the upcoming holidays or keeping their kids safe, holidays or not?
Yeah, these are always tough. Dr. Wohl, if you want to.
No, I mean, this is really, I wish that this has come about a little bit earlier. Maybe the timing is okay because, I do think it's going to take a while to get everyone who wants to get vaccinated, who's 5 to 11 years old, every family that wants their child to get vaccinated. I think it's going to take some time. I would have liked it to have happened weeks before Thanksgiving. So it'll be before the December holidays. Look, Thanksgiving is going to be tough this year, I feel. I think the challenges are that there's a lot of folks who are kind of tired of distancing and not getting together. And I think and who have some faith that their risk is lower, because it is, than it was a year ago. But I do worry that there's going to be some infections that are going to spread with the holiday travel and with the get-togethers. I am totally into a very, maybe impractical for some, but rigorous approach of, people who are vaccinated being together for Thanksgiving. And I think there should be some testing. So for instance, in my household, we are going to get together with another family and we're all going to do rapid tests the day of the event that we're going to get together. And if anyone tests positive, these are all vaccinated people. In fact, some of us are boosted, but we're going to all be fully vaccinated. We're all going to get a rapid test that day. And that lowers the risk that anyone has a viral burden in their nose or throat that's going to spread the virus to any of us. I think those are the kind of measures I'd like to see, but those tests cost money. And if you have have a bunch of people, 10 people coming for dinner, that's a lot of tests. So I know that this is not as feasible as we'd like, but I think we have to take those kind of measures now.
Just a quick follow-up to that. If you are unvaccinated, whether you're an adult or a child, and you do want to travel somewhere, go somewhere for Thanksgiving, what is the date you should be vaccinated by to make sure you're fully protected before you leave? What's that hard line for people?
Yeah, so we know we have a lot of data from the studies that look at antibody responses. And we have studies, of course, of people who get natural infection. And by 2 weeks, most everyone has made antibodies once challenged. So that's where the 2 weeks comes from. So some people start to get protected earlier, but certainly by 2 weeks, if you're going to mount a response, you will have a response. Right now, we travel, we do things, and there's little kids. You walk in the store and there's little kids, and that they're not vaccinated because they're not eligible, and they're potentially vectors for the infection. And we see data from the UK, right, that shows that probably the persistence of their pandemic is driven by younger children who are not vaccinated yet, who are symptomatically and asymptomatically spreading the virus within that nation. I think the same thing is happening here and will happen until we get more kids vaccinated. So I do think that we just have to be careful around unvaccinated people, because not only can they get infection more readily, but if they have infection, they have a higher viral burden that they're shedding to the rest of us. So I think you have to keep your distance from little kids.
I'm going to jump in to ask a question from the chat. I'm sorry, Dr. Thompson. From the chat, following up on the equity question, how do you think vaccinations in rural areas for kids will go where there aren't as many health providers? Do either of you anticipate school systems playing a role in getting kids vaccinated?
I still think that goes back to Dr. Wohl's point about pharmacies being involved too. And even in rural areas, there should be a local pharmacy that will be supplied with vaccine or a pediatrician. But yeah, that's a good question about, when will schools be potentially a site? Schools were definitely sites for some of these mass vaccination campaigns for older kids, but potentially they could be involved in rural areas. I think we'll just have to sort of see how things go over time.
I want to hop in and ask a question for Dr. Naftel. If my child doesn't like shots, is there anything I can do to help them cope emotionally and mentally?
Yeah, great question. So many kids do fear vaccines. Can you hear me okay? Yeah, okay. Yes, so, many adults fear vaccination or needles, and many kids do. I think we got to figure out what the specific anxiety is about. Is it just fear of pain, or is it fear of long-term side effects, or, fear of the unknown? And once we can figure out exactly what it is, I think it's important to have a sit-down talk, and at the appropriate developmental level, talk about the vaccine, talk about the virus. We want to be honest with our kids, but we don't want to scare them. We want them to know that these vaccines have been studied extensively, probably more than any vaccine in history. And so, we know that they're safe. We know that there's still a spread of COVID, and it helps the individual getting vaccinated, and it helps the community. Now, you can, I would recommend that the kid choose a parent, guardian, or sibling to go with them for the vaccine. Maybe even think about sort of how things will play out at the pharmacy or their doctor's office, and sort of rehearse how a vaccination would go. We probably want to remind these kids that they've been vaccinated, most of them, numerous times, and that for the vast majority, they do just fine. And if there are more specific phobias, then there are techniques that you can use, and you can do some desensitization, where you imagine sort of going to the office, what's going to happen, et cetera. But I think it's a very manageable type of anxiety.
Okay, I have another question from the chat. Do we have any idea of the timing of the rollout? When will 5 to 11-year-olds realistically be getting their vaccine? And we can also speak to how UNC Health will be rolling this out as well. How about Dr. Thompson?
Sure. So from what I've heard, realistically, it will be next week, the week of November 8th, that we really get things ramped up, and that parents can take their children in for vaccination. Potentially as early as today or tomorrow, but again, I'll let you all speak to UNC's process.
One thing I'll add, and I'll say, and I think it's really clear that everyone's struggling with how to keep things as clear as possible for parents, and sometimes things can sound confusing. I think on this one, there's been pretty good alignment from the FDA, the CDC, from pediatric organizations, from public health officials, that, on the face of it, the benefits of vaccinating kids 5 to 11 clearly outweighs any perceived risks. The risks are really, really, really low. The risks of COVID-19 certainly outweigh the risks of the vaccine, given the incredible safety, as Dr. Naftel mentioned, of these vaccines. So there's this individual benefit, because we do know that kids have gotten sick, and Dr. Thompson's taken care of a number of them, including in the ICU. And there's a precedent for this. We give lots of vaccines. We give plenty of chickenpox vaccines. We give other vaccines where the number needed to vaccinate to prevent one bad outcome is much, much higher than what we're talking about with COVID-19. And not even if you start talking about the collateral damage of spreading the virus to others from children. So, the number needed to vaccinate to prevent bad things from happening really does favor giving the vaccine to kids, not only for their safety, or I should say, not only for our safety, public health safety, but also for their safety. So maybe, 8 months ago, I would have said something a little different, that children didn't seem to get sick before Delta, and that we saw that it was mostly for public health benefit. We were talking about vaccinating younger children, but Delta's changed everything. ICUs got chock full during the Delta surge. Pediatric ICUs got filled with people too. So, to me, this is really a no-brainer. The vaccines are safe. We now have tried it out on half of humanity before we gave it to 5 and 11-year-olds. We gave it to half the people on the planet. Can't do much better than that to prove how safe and effective it is.
I'm a numbers person. And so, thinking about some of the numbers that are out there, we've seen over 2 million cases of COVID in this 5 to 11 age group, which is just, baffling. Many thousands and thousands of hospitalizations, hundreds of deaths even. And that's not okay for me. That's not okay for pediatricians, parents. And from the modeling studies, it looks like we could prevent in the next 5 months, if enough children get vaccinated, we could prevent 600,000 additional cases of COVID in this age group alone.
And imagine if we, one thing that I think a lot of people don't get is that vaccines prevent people from getting infected, period. If you have 100 people in one room and 100 people in another room, and the first room is all vaccinated and the second room, they're not vaccinated, and you cough COVID-19 virus into each room, many, many fewer people in the room of vaccinated people will get infected. Some will, but that doesn't mean it doesn't work. It really does protect people. And if you don't get COVID, you don't get long COVID. And we do know that double-digit % of young kids who get COVID have some lingering symptoms. And you can't get lingering symptoms from COVID-19 if you don't get COVID-19. So and we don't know this about therapy. We don't know if you give monoclonals or molnupiravir, we don't know if that's going to prevent long COVID in people who are infected. But we do know that vaccines prevent infection. And if you don't get infected, you don't get long COVID. So as a parent, I would be worried about my kid getting really sick, but I'd be more worried that they're just going to get COVID and then have cognitive difficulties or fatigue or all the things we talk about with like chronic Lyme. That's the kind of thing we're seeing with these kids and adults, but you would prevent that if you're vaccinated.
And I just wanted to follow up with some more information about UNC Health's rollout. So supply will be limited at first and appointments will be required, but you can make an appointment through yourshot.org to go through UNC Health. And of course, you can also get vaccines at local pharmacies through the North Carolina Department of Health and Human Services. And you can visit the DHHS website for a full listing of where vaccines are available in your community. We have quite a few questions in the chat that I'd love to get to. Dr. Naftel, we'll go to you for this one. How can parents avoid generalizing fear of COVID-19 with fear of the vaccine with their kids or anyone else for that matter?
I think that comes down to trying to educate, everyone, in North Carolina. We need to figure out the reliable, reputable sources and go there. There's a lot of misinformation. And so, I would try to limit the amounts of, media, exposure, social media, and not let kids just surf the internet or watch all sorts of television, with varying and sometimes non-evidence-based opinions. So I think what we need to do is help the kids see the numbers. It's very clear that many people have gotten sick. Not too many kids have died. That is important to know, but still they can get sick and they can get others sick. And when we look at the other group, the group that's getting vaccinated, we aren't seeing people die. We do see that they are less likely to get COVID, less likely to be hospitalized, less likely to pass it on to other family members. And I think that's really important. There are approximately 140,000 kids who lost a parent over the last 18 or 19 months. And that's catastrophic. And, if we had this vaccine pre-COVID, we'd be looking at a very different scenario. So I think it boils down to finding reputable sources and getting your information straight.
another question for any of our doctors. After my child is vaccinated, do they still need to wear a mask at school?
For now, yes, I would say so, because, at least up front, the majority of kids won't be vaccinated. And so we still need to protect our kids against potential exposures in indoor settings and in crowded settings. And I think that going back to what Dr. Wohl had quoted about the UK and what's sort of been going on there, they did the natural experiment of trying to have kids unmasked in schools, and it did not pan out. So I think, it's great that we'll have the tool of vaccination, and we should use all of the tools in our toolkit to keep preventing spread.
Thank you. So a couple more questions from the chat, and then we will begin wrapping up today's media briefing. We've seen the vaccine is safe for many people, but a lot of parents are concerned about long-term side effects specifically. What's your response to that concern?
So I think there's a lot of misconception. Dr. Naftel might want to speak to this as well, but I think there's a lot of misconception that this vaccine is somehow altering our bodies and our DNA, and that is not the case. So, the mRNA vaccine, it does not integrate within our own DNA. It does what it's supposed to do and creates an antibody response. And we want those antibodies around. We want them to stay around as long as they can to protect us. But the spike protein itself and, these things don't integrate into our DNA. They're not part of us in the long term. And so we don't need to really worry about these long-term ideas of side effects. And, I really think that these COVID vaccines are similar to the vaccines that we give to children throughout infancy and childhood. And those vaccines don't have long-term effects.
Great. And our last question, again for Dr. Thompson, when do you think that a considerable amount of children could be vaccinated?
That's a great question. And I know that there's a lot of hesitancy, which is understandable. This is new, and parents want to do what's right for their children. From what I've seen for survey data in the US, which is mostly from Kaiser Family Foundation, it looks like about a quarter to a third of parents are saying, get my child vaccinated right away. About a third are saying, okay, I'll wait and see. I want some other kids to get vaccinated first before I get my child the vaccine. I want to see a bit more data, and then I'll get my child vaccinated. And then about a third are in the camp of, I won't get my child vaccinated. This is similar to what we saw among adults too, right? I mean, 70% of those over age 18 are fully vaccinated at this point in the US. And, are we going to get to that, 90%? I don't know at this point. And so I think the same for kids. I think we'll get there. We'll get to this 60, 70% level, but I don't think we're going to get to 100%. I do think that by the December holidays, we should see, those who are ready to get the vaccine up front, get vaccinated. So, we should see maybe 30% or so of these children in this age group get vaccinated.
And there's probably going to be a strong correlation between parent vaccine status and child vaccine status.
Definitely.
All right, everyone, that's all we have for today's media briefing. Thank you so much for joining us. We will be uploading this recording to the UNC Health YouTube page as soon as possible today, and we'll be sharing that link as soon as we have it. So thank you all for joining, and have a good rest of your day.
Thank you.
Thank you.
Thank you. Y'all have a good one.